I think it's really important to try to hear the voice of the child that you're treating, and they may only be 4 or 5 years old. I get the question all the time, how can I better manage the symptoms that come along with migraine? And I think it is very important as a parent to get more in tune to what symptoms they're actually experiencing. So don't be afraid to ask your child, especially, I know they may look in pain and you don't want to disturb them and just want them to be in a quiet, dark room, but it's important for us as we're learning what kind of symptoms they have to ask them, do they feel nauseous? Are they feeling belly pain? Do they not want to take a medicine because of nausea? Do the lights bother them? Do they want you to be quiet? So it is important for us to understand what symptoms they're experiencing so that we can better address them and also make sure we have the right diagnosis. It's really hard. I don't think we fully even understand the whole pathophysiology of why migraine happens. So completely understanding or explaining it to others is very hard even for an adult. I explain it as it's not that you've done something wrong. And it doesn't mean that you're different or weird. It means that you have a process that happens, that it's likely something that you inherited, meaning other people in your family have it and they pass it down to you. And sometimes your brain goes through periods where it's sick, and it can make you feel sick to your stomach and dizzy, and sometimes see things in your vision or feel funny. And it's temporary, and hopefully it will go away, and we're going to use medicine so that you don't experience it for as long. So whenever I am training someone new that has not been involved in headache care before in kids, I think the biggest key is understanding the visit is going to be different. We are not just treating a child, we're also treating their parents or their caretakers. And so our visit is going to be very dynamic. There's a lot of people sometimes that come to these appointments. You may have their 2-year-old sibling running in circles around the room. And so you have to be okay with different dynamics. And so expect that coming in. But the clinical pearl, I think, is very important is to, despite all this craziness and someone's demand, driving the history, maybe the parent is saying, I'm going to tell you from A to Z everything that's been going on. I think it's really important to try to hear the voice of the child that you're treating. And they may only be 4 or 5 years old, but I think it's very important to ask them, what pain are you experiencing? Where is it located? What are you feeling? Because if they feel that they're engaged in their care, and that their voice is being heard, they're more likely to be compliant with medicines, they're more likely to understand what is happening to their body, and that you understand what is going on, and then it becomes less scary. So I find that when I'm treating children with migraines, you do have to change your approach during your history taking and during your exam. With history taking, even though it's a serious topic, it's pain and it's horrible symptoms that can be very disabling, and the parents are very worried about their child. They may also often be worried, do they have a tumor or something else serious going on? I think it's important to try to make it a fun experience for the child, because if they pick up on your body language and the parent's body language, they're very serious and worried, which is a serious topic, they're less likely to participate in the visit. And it is harder to get more information out of them, and it's also harder to do an exam, which is a really important piece so that we can reassure everyone that you have a normal exam. It may seem unconventional, but when we come into a room, we often don't just start off right away, why are you here and what are going on with the headaches. I start off engaging like, wow, that's a really cool haircut you have going on. I like the spikes, or wow, I just noticed you have really fun cat socks on. Tell me about that. Do you like cats? Or do you have any pets, or what's going on? Oh, you're missing school today. What's your favorite part of school? And so engaging right directly with the child, and that's the first person you interact with, I think is really reassuring to the parents, because they understand, this person gets it. This person understands that my child is the reason I'm here, but also the child feels more comfortable talking to you. And I find that it's really fun to actually hear a little bit about what they like to do, and then they're more open to discussing everything with you. So you got to make it a little bit fun.